Bone grafts. When we need bone grafts. After teeth extraction, to have enough bone to place the implant, we can use bone graft materials. It can be in granule forms, crunch forms. And also bone grafts has, as they have granule forms, they have cortical plates, block grafts, and also it can be covered by membrane on them. Before implant placement, if we don't have enough bone in width and length, so we have to augment some bone graft material to the side to place the implant, and it will help the implant stay much more stable in the years. For the bone grafts, we have several materials like synthetic materials, human-based and enamel-based materials. During the treatment plan, we consider what to use. For example, for when we will place an implant and the body of the implant is opened a bit, we can put human-sourced bone grafts. And also, if the patient has allergic to any of the bone grafts, we can change it according to his or her needs. After bone grafting, we wait for about 3 months or 4 months, and then we continue the procedure. For the sinus lift, again, we lift the sinus and put bone graft materials and make enough bone there, and we can place the implants too. If you have any needs about bone grafts, you can always contact us.